Okay, so let's talk about ET tube safety, all right? So an endotracheal tube, or an ET tube, is going to be in a patient that needs it. They require that invasive mechanical ventilation. And there's numbers on the side of an ET tube that correlate to the depth of placement inside the patient. So when you're caring for someone that has an ET tube, just like an NG tube that has the scale on the side of the tube, you want to note where the tube is at in depth in relationship to the patient's immovable marker, so their gum or their teeth. And we measure it at the gum or the teeth and not the lip, because lips can swell and move and they get slimy. And so if I said, oh, it looks like the ET tube is at 22 centimeters at the lip, and then the lip bleeds or gets all big, it's gonna look like the tube moved in because now the lip is big and out here. So always at the gum or the teeth, the things that don't move, structures that don't move. But when dealing with a patient that's intubated, you just want to be thoughtful about where it is, and then pay attention to the location at the gum or teeth before or after transport, and then as you're moving the patient around, turning side to side, just repositioning. This right here is the inline suction catheter that's connected. This side will be out connected to wall suction, and so then this is the ventilator circuit. And when we need to provide some airway clearance with suction, this button right here is how we activate the suction. So if it's pressed down, suction is happening, and if it's pushed up, it's not. So the way you would suction a patient is you would come over to your ventilator and you would press the FiO2 100% up right here to give them extra FiO2. Because as we suction, we're essentially taking out the air that's in their airway. So I hit 100% FiO2, and then I anchor my hand here, and I just advance this inline catheter, and you see the cover getting all bunched up, but I advance the catheter until I get right above what we call the carina. You don't want the patient to get trauma from being suctioned a lot, so if they start to cough, stop advancing the catheter, press the button to be activating the suction, and then pull out slowly. You can pull pretty slow and just clear out a whole bunch of mucus and boogers. You can go for 10 seconds on a suction pass, and that's a long time for a patient to not be getting air, so just know that you're taking their air while you're suctioning them. The other piece is for safety. This button turns to be propped up so it doesn't actually get depressed and pull air from the patient. So, again, 100% FiO2 before you provide the suction. Pay attention to where the ET tube is at, related to the gum or the teeth. And then don't suction for more than 10 seconds. And after you suction, the catheter should not be in the ET tube space taking up room. So don't leave it like that. Make sure that it's pulled all the way out. And then move it out of the way so the patient can't get a hold of it.